Welcome to the deep dive. We're here to cut through the noise, pull the key insights from a pile of sources, and basically make you instantly informed. Today, we're diving into something that's, well, it's often described as silent, insidious, even incurable, a real threat in the animal world. We're talking about paratuberculosis, but most people know it as Johne's disease. So in this deep dive, we'll really unpack what Johne's is, why it's such a tough nut to crack management-wise. And we'll focus specifically on how it affects two really interesting animal families. Camelids, think llamas, alpacas, and cervids, so deer and elk. We're going to pull out the essential stuff you need to grasp this complex disease.
Exactly. And to do that, we've gone through a pretty hefty expert report, plus some additional pieces focusing right on paratuberculosis in these specific animals, camelids and cervids. So our mission here is to really distill that down, pull out the most crucial bits of information from all this material. The aim is to give you a clear, actionable picture of what this disease is all about. It's quite perplexing, actually.
Okay, let's get into it then. What exactly is this hidden enemy? What are we dealing with when we talk about Johne's?
Right. So Johne's disease, at its core, it's a chronic condition, it's contagious, and unfortunately, it's fatal. It's an inflammation of the gut. The technical term is granulomatous enteritis.
Granulomatous enteritis. Okay, break that down a bit.
Yeah, think of it as this long-term, really destructive inflammation. It causes these clumps of immune cells to form in the intestinal wall. And slowly, relentlessly, this destroys the gut's ability to actually absorb nutrients from food.
Okay, got it. And what causes it?
It's caused by a specific bacterium, Mycobacterium avium subspecies paratuberculosis. We usually just call it MAP.
MAP. Yeah.
And the really key thing about MAP, to understand this, it's incredibly stealthy and very persistent. It's what we call a slow-growing, acid-fast bacillus. That acid-fast part means it has this tough, waxy outer coat.
Like armor.
Kind of, yeah. It makes it super resistant to, harsh conditions, disinfectants, lots of things. And it's also an obligate intracellular parasite, meaning it has to live inside the host's own cells. It basically hides out in there, multiplies where the immune system struggles to find it.
Wow. Master of disguise.
Pretty much. And that combination makes it really hard for the body's defenses and even our diagnostic tests to actually detect it sometimes.
And you mentioned it can survive in the environment for ages.
Yeah.
Like over a year.
That's right. Over a year, especially if conditions are cool, moist, dark places. Think soil, water sources.
That sounds like a nightmare to get rid of once it's, established somewhere. Is that the biggest problem for control?
That environmental persistence. Oh, absolutely. It's a massive challenge. That's why preventing it from getting there in the first place is so critical. Imagine trying to clean up invisible glitter, like you said, that's been sitting around for months. It's tough.
Yeah, I can picture that.
And to make things even trickier, there isn't just one single type of MAP. The most common one is type 2, sometimes called the C strain, for cattle. But don't let the name fool you. It infects a whole range of animals: sheep, goats, deer, elk, llamas, alpacas.
So it jumps species easily.
It seems to, yes. There are other strains too, like type I or S for sheep, and even one called the Indian bison type. But type 2 is the main one we see in camelids and cervids.
Okay. You mentioned this iceberg effect earlier. That sounds genuinely terrifying if you're managing a herd. The idea that what you see is just the tip. How does a disease this sneaky actually move around? How does it spread?
Right, the iceberg. Well, the number one route is fecal-oral, meaning through contaminated feces, basically. Infected animals shed the MAP bacteria in their manure. And here's the kicker. Even animals that look perfectly healthy, what we call subclinical shedders, can be shedding billions of these organisms every single day.
Billions, wow.
Yeah, so that manure contaminates feed, water, pastures, anything it comes into contact with. And other animals get infected by ingesting that contaminated material, often without anyone even realizing there's a problem.
And it's the young ones that are most at risk.
Yes, typically animals under 6 months old are the most susceptible. They can pick it up nursing on teats that have manure on them, or by drinking contaminated milk or colostrum.
Colostrum, that's the first milk, right? Super important.
Crucial, yes. Or just ingesting contaminated feed or water like the adults. And it's worth mentioning, in utero transmission can also happen.
So before they're even born?
Yeah, an infected mother can pass it to her fetus, especially if she's in the later stages of the disease.
Okay, so the bug gets ingested. What happens then inside the animal?
So once it's ingested, MAP gets taken up by these specialized immune cells. They're called macrophages, kind of like the body's cleanup crew. This happens down in the lower part of the small intestine in areas called Peyer's patches. These are like little immune surveillance centers. But instead of being destroyed, MAP actually multiplies inside those macrophages.
It hijacks the cleanup crew.
Essentially, yes.
Yeah.
And this triggers that chronic inflammation we talked about, the granulomatous reaction.
Yeah.
Over time, this causes the intestinal wall to get progressively thicker and thicker.
And that stops the nutrients getting through.
Exactly. It severely impairs nutrient absorption. The result is something called a protein-losing enteropathy. The gut just leaks protein, basically, which leads to that severe weight loss, the wasting, even if the animal is still eating okay.
It's like a slow internal sabotage.
Yeah.
That sounds awful. And then there's that incubation period you mentioned. Years, potentially. That must be a huge part of this iceberg thing.
It absolutely is. That's the really insidious part. The time between infection and showing actual signs of illness, the incubation period, can be 2 to 5 years, sometimes even longer.
Years where they look fine but could be spreading it.
Precisely. During that whole time, the animal often looks completely normal, perfectly healthy, but it might be intermittently shedding those MAP bacteria into the environment. And that is the iceberg phenomenon in a nutshell. For every one animal you see that's clinically sick, skinny, maybe diarrhea, there are likely many, many more, maybe 10, 20, who knows, in the herd that are infected but look fine. Subclinical carriers.
Wow. Silently spreading the disease. Like a hidden time bomb.
That's a good way to put it. And it makes control exceptionally difficult, as you can imagine.
Okay, we've got the general picture now. Let's zoom in, like we said.
Yeah.
First up, the Camelidae are llamas and alpacas. What does John's look like in them specifically? What should owners be watching out for?
Right. So John's is confirmed in llamas and alpacas worldwide. And it's primarily that cattle strain, the type 2 MAP, that's responsible. Now, the good news, perhaps, is that the naturally occurring incidence seems to be relatively low compared to cattle. But when it does hit, the consequences for that individual animal or even the herd can be really severe.
So what are the telltale signs in llamas and alpacas?
The most consistent signs are progressive weight loss and weakness. You see this profound emaciation, this wasting away. Even though, especially early on, their appetite might seem perfectly normal, they're eating, but just fading.
Is diarrhea common, like in cattle?
Actually, no. That's a key difference. Diarrhea is much less common in camelids with Johns. If you do see it, it's usually only in the very final terminal stages of the disease.
Okay, so mainly weight loss and weakness. Anything else?
Yeah, you might see other more general signs like lethargy, just being dull and listless, a poor hair coat, and sometimes you see something called bottle jaw.
Boss jaw.
Yeah, it's a swelling under the jaw, kind of a fluid buildup, technically submandibular edema. It looks a bit like a pouch or bottle hanging there. It's caused by that severe protein loss we talked about, the protein-losing enteropathy. There's just not enough protein in the blood to hold the fluid in the vessels.
Oh, okay.
And another thing about camelids, the clinical course, once they start showing signs, tends to be shorter and more rapidly fatal compared to cattle. It seems to progress faster in them.
That's concerning. What about the bigger picture herd implications? You mentioned it's even in their native regions.
That's right. MAP has been confirmed in alpacas way up in their native environment, the Chilean Altiplano, which suggests it might be, more widespread than we perhaps thought, even in those more remote areas.
How did it get there?
The most likely source is contact with other infected domestic livestock that share grazing areas, like sheep. And this really highlights a big risk factor, exporting camelids without checking them for paratuberculosis first. There was a documented case, for instance, where a high-shedding alpaca was exported and posed a huge risk to its new herd overseas because it hadn't been screened. So biosecurity around movement is key.
Right. Okay, let's shift gears to the cervids, the deer and elk. A lot of us see these animals farmed or wild. How does John's show up in them? And what about the implications for wild populations, especially that interaction with livestock?
Yeah, John's is definitely a recognized issue in both farmed deer like red deer, fallow deer, and also in wild populations, including white-tailed deer and elk. And what's interesting, maybe concerning, is that deer seem highly susceptible to MAP infection. They might even show clinical signs at a younger age than cattle do, sometimes surprisingly young.
Younger age, really?
Yeah. The main signs are similar in principle: chronic weight loss, severe muscle wasting. But in young deer, the disease can sometimes present almost acutely. You can see rapid weight loss over just a few weeks. There have been reports of outbreaks with high sickness rates, high mortality, in deer that were only 8 to 27 months old.
Wow, that young. Is diarrhea a sign in deer?
It is, yes. Especially in farm deer, diarrhea is considered a significant clinical sign, often present in those terminal stages. You might see telltale fecal staining around the tail area and down the back legs on the hocks.
Okay. Any other visible signs?
Sometimes affected deer have really rough-looking coats, maybe described as moth-eaten, or they might have patchy hair loss, alopecia, often thought to be linked to the stress of the disease.
And that wildlife-livestock connection, that sounds like a potential headache for everyone.
It really is. That wildlife-livestock interface is critical here. If Johne's is present in wild deer or elk populations, they can act as a reservoir, potentially infecting domestic livestock like cattle or sheep that share the same pastures or water sources.
And vice versa. Livestock infecting wildlife.
Absolutely, it's a two-way street. The bacterium can transmit back and forth between captive or farmed animals and wild populations if they share the same environment. We've seen this documented, for instance, in Tule elk and deer at Point Reyes National Seashore in California, where they mix with domestic cattle herds.
So does that mean any shared land is high risk?
Well, the risk in really open, extensive rangeland is probably pretty low, but it definitely increases significantly in areas where you have higher animal density. Think places where animals congregate, like around shared water sources, feed grounds, or maybe bedding areas. Manure can build up there, and that really raises the risk of cross-species transmission.
Okay, so it's sneaky, it hides for years, lots of animals might be infected without showing signs. Which brings us to diagnosis. How on earth do veterinarians even begin to diagnose this disease? It sounds like chasing a ghost, especially those subclinical ones.
You've hit the nail on the head. It is notoriously difficult to diagnose, particularly during that long subclinical phase when the animals look healthy. And frustratingly, no single test is perfect. So often you need to use a combination of different diagnostic approaches.
What are the main types of tests?
We generally group them into two main categories. First, you have organism-based tests. These are trying to detect the actual MIP bacterium itself. The classic one is fecal culture, trying to grow MAP from a manure sample. This is often considered the gold standard, the definitive test.
But there's always a but, isn't there?
There is. The but here is that it's incredibly slow. MAP grows so slowly in the lab. It can take anywhere from, say, 45 days up to 16 weeks to get a result.
16 weeks. Wow, that's not very practical if you need answers quickly.
Not at all, which is why PCR has become much more popular, polymerase chain reaction.
Right, the DNA test.
Exactly. Think of it like a super fast genetic scanner. PCR looks for MAP's DNA directly in the fecal sample or sometimes in tissue samples. The huge advantage is speed. You can get results in just 2 to 7 days.
Much better.
Much better. And its sensitivity and specificity are generally comparable to culture now. So it's really becoming the preferred method for finding those animals that are actively shedding the bacteria. You can also do pooled fecal PCR, where you combine samples from several animals and test the batch. It's a more cost-effective way to screen a whole herd.
Okay, so that's looking for the bug itself. What's the other category?
The other category is antibody-based tests, or serology. These tests don't look for the bug, they look for the animal's immune response to the bug. Specifically, antibodies against MAP in the blood serum. The most common one here is a lysa enzyme-linked immunosorbent assay.
Well, Lisa, okay. Pros and cons.
Pros. It's fast, relatively inexpensive, and pretty good for screening large numbers of animals quickly. It can give you a decent estimate of the prevalence, the level of infection within a herd. Cons. Here's its Achilles heel. Its sensitivity is often quite low in those subclinical animals, the ones that aren't showing signs yet.
Why is that?
Because it often takes a long time for the animal's immune system to produce enough antibodies for the ELISA test to actually detect them. So an infected animal, especially early on, might test negative simply because that detectable antibody response hasn't kicked in yet. It's a late-stage indicator, often.
So you could get false negatives easily in the early stages.
Exactly, which complicates control efforts, obviously.
Are there other ways to confirm it? Maybe after an animal dies?
Yes, absolutely. Post-mortem diagnosis is highly definitive, especially if you have an animal that was showing clinical signs. This involves a necropsy, an animal autopsy. Vets will look for characteristic gross lesions changes you can see with the naked eye.
Like what?
The classic finding is that thickened corrugated intestinal wall, especially in the lower small intestine, the ileum. It's often described as looking like the folds of a brain. It's so ridged. You'll also often see enlarged, swollen, sometimes fluid-filled lymph nodes in the gut mesentery. Those are the mesenteric lymph nodes. And sometimes the lymphatic vessels themselves, which drain the intestine, become visibly thickened and cord-like.
And under the microscope.
Under the microscope, histopathology confirms it. The pathologist will see that characteristic granulomatous enteritises, those clumps of inflammatory cells, the macrophages, and often they can stain the tissue to see the little red acid-fast MAP bacteria packed inside those cells. That's pretty definitive proof.
So that iceberg effect we keep coming back to, it's not just about the hidden spread, it's also a massive headache for vets trying to even find the problem reliably in living animals.
Precisely. That's the heart of the diagnostic challenge.
Does that mean a lot of herds might have John simmering away, maybe for years, without anyone knowing until animals start getting really sick?
Unfortunately, yes, that is often the case. It can smolder undetected for a long time before clinical cases start popping up. That's why testing strategies and understanding the limitations of the test are so crucial. It's a really complex puzzle to manage.
Okay, this definitely sounds like a tough battle, especially since you said earlier there's no cure.
Yeah.
So if you can't cure it, what can actually be done? How do people manage and prevent the spread of John's disease?
You're right, it is a tough battle, and you've hit the key point. There is currently no cure or effective treatment for John's disease once an animal is clinically ill. People have tried various antibiotic combinations, mainly experimentally, but they just aren't practical or successful long-term in livestock settings. They don't clear the infection. So all the effort has to focus squarely on prevention and control. And that's not a quick fix, it's a long-term commitment. It requires real vigilance.
Okay, so what does that long-term commitment look like? What are the strategies?
It really boils down to breaking that cycle of transmission, especially protecting the young, most susceptible animals from getting infected in the first place. It takes a multi-pronged approach. First and foremost is biosecurity. You have to stop the disease from walking onto your farm.
How does it usually walk on?
The most common way Johns gets into a clean herd is through buying an infected animal that looks perfectly healthy, one of those asymptomatic carriers. So, biosecurity strategies include things like maintaining a closed herd, if possible not bringing in new animals, or if you do buy animals, sourcing them only from herds with a documented history of testing negative for Johns, and then critically, quarantining any new arrivals, keeping them separate, and testing them before they ever mix with your main herd.
Makes sense.
I hope that.
What else?
The next absolutely critical area is calf and cria management, or management of fawns, if we're talking deer, the young ones. This is probably the single most important control point.
Because they're the most vulnerable.
Exactly. So you need meticulously clean, dry, manure-free birthing areas. And here's a really crucial step, though it can be tough management-wise. Removing the newborn from the mother immediately after birth.
Immediately. Why so fast?
To prevent it from nursing on teats potentially contaminated with MAP-infected manure or ingesting manure from the environment right away, then you need to feed colostrum and milk only from dams that have tested negative for Johns. Or alternatively, use pasteurized colostrum or milk or a high-quality milk replacer. Heat treatment, like pasteurization, can kill MAP.
Okay, and keep them separate.
Yes, raise these young animals in a completely separate, clean environment. Absolutely no contact with adult animals or their manure until they're much older, ideally over a year old.
Wow, that sounds intensive.
It is intensive, but it's the most effective way to stop the cycle. Next up is herd sanitation, just reducing the overall load of bacteria in the environment. Simple things like elevating feed bunks and water troughs so manure doesn't easily contaminate them. Regular, thorough cleaning of pens and barns. Managing manure properly composting might help reduce pathogen load over time. And crucially, avoid spreading manure from the adult herd onto pastures where young stock are going to graze. That's just reseeding the problem.
Right, don't put the bugs where the babies are.
Precisely. Then there's test and cull. Using those diagnostic tests we talked about strategically to identify animals that are likely shedding bacteria, especially high shedders, and removing them from the herd to reduce transmission.
Which tests are best for that?
Often a combination. Maybe ELISA for screening, followed by PCR on the positives or on high-risk animals to confirm shedding.
Okay. Is there anything else? What about vaccination?
Vaccination is another tool, yes. Vaccines are available in some countries, mainly for cattle. Now, it's important to understand what they do and don't do. Vaccines do not prevent infection entirely, and they don't completely stop animals from shedding MAP. What they primarily do is reduce the severity of the clinical disease if an animal does get sick, and they can significantly reduce the amount of bacteria the animal sheds into the environment, so they can help lower transmission pressure.
Are there downsides to vaccination?
Yes. A major one is that vaccination can interfere with the skin tests used for diagnosing bovine tuberculosis, TB, Since MAP is related to the TB bacterium, the vaccine can cause false positive reactions on TB tests. That's a significant issue for TB control programs.
Oh, okay.
Complicated. It is, and specifically for the animals we're focusing on today, camelids. There are currently no effective licensed vaccines available. There's research ongoing, but nothing commercially available right now.
So for llama and alpaca owners, vaccination isn't even an option yet.
Not currently, no. They have to rely heavily on the biosecurity, young stock management, sanitation, and testing strategies.
Okay, lots to manage there. Finally, let's touch on something that might hit closer to home for some listeners. Is there any known human connection to this disease? I've heard whispers, maybe online, about a possible link between MAP and Crohn's disease in people. Is there anything to that?
That's a really important question, and you're right. It is something that comes up. It's actually a debate that's been simmering in the scientific community for, believe it or not, over a century. There's this long-standing discussion, this hypothesis about a potential link between MAP, the Johne's bacterium, and Crohn's disease in humans.
Crohn's disease.
Yeah.
That's a chronic inflammatory bowel condition, right?
It's exactly, a serious chronic inflammation of the digestive tract. And the debate arises partly because there are some similarities in the pathology, the way the disease looks in the tissues between Johne's in animals and Crohn's in humans. Both involve that granulomatous inflammation.
Okay, so similarities. But what's the actual evidence for a link? Has MAP been found in people with Crohn's?
Well, here's what the evidence shows. MAP has indeed been isolated, meaning grown in the lab, from tissues of some patients with Crohn's disease. Not all, but some. And furthermore, when researchers do meta-analyses where they statistically combine the results from lots of different studies, they have found a significant positive association, meaning studies tend to show MAP is detected more often in Crohn's patients than in people without the disease.
Okay, so it's found there sometimes, and there's a statistical link. Does that mean MAP causes Crohn's disease?
And that is the absolute crucial point. Despite these findings, the isolation, the association, a definitive causal relationship between MAP and Crohn's disease has not been established.
Not proven.
Not proven. Association doesn't equal causation, as scientists always say. There could be other explanations. Maybe MAP is just an innocent bystander in an already inflamed gut. Or maybe it plays a role in some cases but not others. Or maybe it triggers the disease in genetically susceptible people. We just don't know for sure yet.
So the zoonotic potential, the risk to humans, is still kind of an open question.
Exactly. The potential for MAP to be transmitted from animals to humans and actually cause disease remains a subject of very active, ongoing scientific investigation and debate. There's a lot more research needed to really understand what, if any, connection truly exists. So for now, it's an unresolved scientific question. We need to be careful not to jump to conclusions.
Right. Maintain that impartial scientific view. Okay, so let's try and wrap this up. We've definitely seen today that Johne's disease is, well, it really lives up to that description, a hidden enemy. It's insidious, incurable, has that incredibly long incubation period, which makes diagnosis, especially early diagnosis, a massive challenge. That whole iceberg phenomenon is key. But despite all these hurdles, despite the lack of a cure, it's clear that having informed prevention plans, robust long-term management strategies, these are absolutely vital. Vital for protecting animal health, animal welfare, and also the economic stability of farms and even conservation efforts involving these animals. So hopefully next time you encounter a llama, an alpaca, or maybe see some deer or elk, you'll carry with you a bit of a deeper understanding now, an appreciation for these silent battles being fought under the surface to protect them from diseases like Johne's.
And maybe this leaves us with a final thought to ponder. Thinking about these iceberg diseases, like Johne's, where so much of the problem lies hidden, undetected for potentially years. How does understanding that dynamic, that hidden burden of disease, maybe inform how we approach other really complex health challenges? Perhaps even in human health, where symptoms of certain conditions can also hide for years before the full picture finally emerges. It makes you think about the value of early detection and prevention across the board, doesn't it?